Hello, my name is Asia Rains, and I am an MPH 670 Methods in Public Health Research. And my poster is dedicated to maternal health disparities in America. I used secondary data for my first poster, but I've also used quantitative, qualitative, and human subjects research as well. So, for starters, introduction background maternal mortality and morbidity remains a pressing public health issue in the US. Disparities are observed across race, ethnicity, age, insurance status, and geography. Sources say information was obtained from Centers Disease Surveillance Systems, March of Dimes, peer review literature. So that was where my sources came from. Abstract. This study analyzes maternal health disparities in the US using the resources that I provided, as well as peer literature. So the methods is what I've expressed before. Discussion and interpretation is Black women who have risks related to maternal health, older women, and age increases morbidity and mortality. Medicaid recipients typically have lower prenatal care and access. They also have higher complications. And then prenatal care, initiation, and quality of care are crucial proactive factors. Once again, we have references on the first poster, and then at the bottom, it's maternal health disparities. It remains severe and persistent in the US. Black women continue to face the greatest risk driven by structural inequalities, delayed care, and system level barriers. Public health strategies should prioritize expanding Medicaid postpartum coverage, increasing funding for midwives, doulas, and community birth workers, implementing mandatory clinical biases training, improving hospital qualities and standards in high risk communities, addressing maternal care uh, in rural areas or rural regions. And these findings will emphasize the need of equitable and cultural responsive maternal health policies. So, additionally, um, here are more like quantitative, qualitatives, and peer review research. So, findings align with national research showing that maternal mortality disparities persist even after adjusting for income, education, and insurance statuses. This pattern indicates that structural racism, provider biases, and unequal access to high quality maternal care are major contributors to poor outcomes. Older maternal ages and chronic diseases further magnify risk. Medicaid coverage and royal residence significantly limit access to early and adequate prenatal care. The secondary data analysis strengthens the understanding that maternal health disparities are not solely clinical problems. They reflect systematic inequalities embedded in the US healthcare delivery, insurance systems, and geographic distribution of maternity services. So these are not just clinical errors, these are social errors that occur. And based on the research, it shows that um, it affects income status, race, um, where you live, geography, etc. So here's a chart here, and it just shows a breakdown of the variable, the relationship to maternal morbidity and mortality, and then it shows the strength of association based on the research. So Black versus white is increased mortality risk, and this is a strong strength of association. Income level. So it says mortality with higher income is decreased to experience mortality or morbidity, and that one is moderate. Insurance type, Medicaid, have increased complications, which is a moderate strength of association. Prenatal care, um, prenatal care access is adequate care and it decreases mortality. So women that receive prenatal care access experience lower mortality or morbidity experiences. And that's a strong association. Geographic, so rural areas have increased mortality or morbidity, and that one is a moderate research as well. So, based on these findings, it shows strong or moderate based on race, income level, insurance, if you have prenatal care or access to prenatal care, as well as your location, your geographic location. So, human subject research. This is from actual women who have expressed these things. Women of color often report not having being believed when reporting pain or symptoms. So basically, they don't feel like they're being believed, like people don't believe what they're saying when they report that they are in pain. Black mothers reported more instances of providers dismissing their concerns. Medicaid patients described long wait times, fewer provider options. Rural women in rural areas travel long distances, 50 to 100 miles for prenatal care. Many women of color describe fear, anxiety, and mistreatment because of prior negative interactions with the healthcare system. Women describe feeling ignored and rushed during prenatal visits. Black women reported not being taken seriously until their symptoms have worsened. And then here it just further explains, based on the research, that Black women are 3 times higher the mortality or morbidity compared to white women. Hispanic women are slightly lower than white women. And there's a strong positive association between being a minority, being a Black woman, and experiencing maternal mortality or morbidity. And overall, based on this research and based on these findings, you can tell that there are a number of things that affect the maternal health um, disparities. And these are things, like we've said before, that needs to be addressed, and that we need to be proactive for. So going back, like I said, having these um, increased funding in midwives and doulas, and birth workers, and having trainings on educational maternal health remedies. These are things that can substantially reduce these complications and make it easier for the entire healthcare system, not just for the people that are affected by race, income, and geography. So, this is just some findings based on the research and based on this is secondary data, qualitative, quantitative, as well as human subjective. So, thank you so much for your time and have a great day.